and welcome to the Sex and Wellness Podcast with Dr. Mary. Today, I am here with Dr. Allie Day. We're really excited to be together. We've been trying for months to get together.
Yeah.
And
like 6.
Yeah, and we were planned for last weekend, but I lost my voice at Chris Stapleton.
She was really into it.
So my heart and soul was way too into the music. That Tennessee whiskey took my voice. So Allie is a chiropractor here. She is in Lotus Chiropractic and Acupuncture. She specializes in women's health, especially around pregnancy and postpartum, but overall women's health as well. So thank you for coming today.
Thanks for having us.
Yeah.
I mean, I'm sorry. This is your dog.
Yeah, she's hanging out with Miss Maya right now. Maya Papaya just wants to snuggle.
Yes.
So, yeah. So today we are going to be talking about medical gaslighting. And for those of you that don't know what gaslighting is, it's basically, in general, we're both very familiar with gaslighting. I've personally been gaslit in unfortunate relationships, but also a lot in the medical community because I've had conditions such as chronic fatigue and a bunch of other things that people couldn't understand and then just pass it off like I was making it up or that I was crazy and that it was all in my head. So that's essentially what gaslighting is. Just if you tell somebody like, hey, I'm having back pain and they can't figure out what the back pain is, they might say it's in your head or it's not real or it's invalidating, if that makes sense. You can describe it probably a little bit better. No?
Yeah, no, I think it's the same thing. I think it's when you have this experience or recollection of what's going on in your body. Medical gaslighting is really more about like, I'm showing up with these symptoms and nobody being able to tell you what's going on. And so then they're telling you either not a real thing or they just don't believe you or they're not running the tests on you. And so, yeah, you start ending up in your head going, am I crazy for believing my body or believing that those symptoms are there? So
yeah, it's exactly it. And where the term came from, medical gaslighting, we were saying earlier, it's not even just saying, it's avoiding the practitioner even saying, I don't know. The reality is we are human and we don't know everything.
Yes.
We never will. And if you are with somebody that acts like they know everything in healthcare, I feel like that's the biggest red flag.
Yeah. And it's also, too, it's about you being an expert in your own body, right? It's always, it can be very invalidating to be like, well, this is my experience of something and have somebody else go, no, that's not right. Or that's not what I'm hearing, or that's not kind of whatever. So it's about also, too, just knowing that you, especially as women, right, we are the own experts in our body. And usually what we are feeling or thinking or, again, intuitively knowing, that is worth everything, right? And like, you're not making it up. Like, you feel that way for a reason. There's something going on.
Yeah. And we're not taught to advocate for ourselves with our intuition. And so that's what we're going to be talking about today, is just some understanding a bit more about what it is, why it happens, some examples, and what we can do about it to help you guys advocate for yourselves, because that's huge and it can almost be life or death. Sometimes. In my case, it was actually. And so I can share my story. So Dr. Allie and I we see a lot of patients that have been gaslit because you and I both see a lot of really chronic conditions or conditions of people that it's not well understood why it's happened, and they've been to multiple providers over and over and over. And sometimes we're the first people to validate their symptoms are real.
Yeah. Or even say, like, I may not understand what's going on, but because I get a lot of people, and I'm sure you do too, who come in and they'll say, this is what's going on with me. And then they themselves will say, and I don't think that I'm crazy, or like, or something about like, I don't think that makes sense, or like, there's just a lot of stuff going on, but nobody, and they'll laugh about it. And I'm like, no. Like, no, let's not do that. Let's not laugh at ourselves about saying that, whatever. Like, that's legit. Anytime somebody says like, I don't know, this is like a weird way to explain it, but this is what I'm feeling in my body, then I always try to not advocate, but affirm them. Like, if you're saying that's what it is, then I will believe you. I have no reason to not believe you, right?
No, exactly. And it can be, I almost feel like intuition is just put aside, right? It's like, oh, if you don't meet the specific box criteria of this and this and this, then we don't know. So we're going to tell you it's not real or it's invalid. And the thing is, the reality is that yes, maybe they don't know, but the point is that the best way to respond to that is let me do some more research on this or let me get back to you, or quite honestly, I'm not sure. Let me refer you to somebody, right?
Yeah.
Versus the opposite, which will happen is be like, you're fine. There's nothing wrong with you. Like, you're good to go.
Or it's all in your head. Here's an antidepressant, which is a lot of what I hear too. Like, we don't know what's going on with you, but you must be crazy. So let's have that. Or like, here's an antidepressant. It must be. And again, we do know that chronic pain causes depression, right? When you're in chronic pain and you're not getting any answers, right? That really does start taking a toll. But again, for most women, because we have such interesting systems and hormonal stuff, that typically is something that they get told a lot, which is like, this isn't really in your body. This is in your head. This is in your mind. Here you go.
Or it's because you're a woman.
Yes, or it's because you're a woman.
Oh my God. I had somebody recently went to a neurologist and she literally just had, I want to say it was a few seizures or some neurological event. She waited for like months to see a neurologist, and she goes in to see the neurologist and she's like, I'm tired, this and this. These are the symptoms. And he literally said like, oh, it's because you're a woman and you're getting older. And I was like,
that's a red flag.
I was like, okay, so that's your cop out.
Yeah.
I was like, okay.
That's hugely triggering.
I'll tell them. And I used to be like, oh, I don't want to step on any toes. And I'll be like, that's bullshit. I'll tell them it's bullshit. And that, no, like find another neurologist.
Yes, right.
And I will, we have plenty that I know that are great. And I'm like, go see them. Right.
Yeah.
And I've probably done this in the past, like as a new PT, when in the PT where we were talking earlier about egos, and the programs that I would go through in orthopedics was like, oh, if you don't get somebody like you should be able to get everybody better, this and this and this. And if they don't, like it was like, put it on the patient. Like it's their fault. And I remember thinking like, that doesn't feel good. So I don't know if I've inadvertently done it or whatever. I'm just like, when you're in those systems and people are just, we're not God. And we're not, whether you believe in God or not. But the point is, it's more of like, that's not real. And we're humans and we all like deserve to be heard. And that if you're in an environment, even if you're a practitioner that is seeing it with your colleagues, like that's toxic in and of itself, because that bleeds into everything in the culture of that clinic. Right. And I do remember I don't think I ever specifically like said anything to anybody, but the point is that the culture was more of, okay, you should be able to get everybody better. And if not, like maybe they're depressed or something like that. And I was just like, I don't think that sounds good.
Yeah.
But, you know,
I don't think that's the truth. That's not the truth. Yeah. If you don't, as a practitioner, get everyone better, then you're,
oh, it's not true
it's
at all.
a mental thing.
Oh, it's not true at all. I will say, though, that I think the times that, and now I'm post-cancer, so like it's totally different, but I'll have people that come in, they're like, oh, I have a headache. Do I have a brain tumor? And I'll be like, you don't have a brain tumor. And then now I like don't say that. I'll be like, why do you think that?
Yes, right.
Right? Like, why do you think that versus like that I know what gaslighting is, like, okay, no, like let's entertain this. Let's talk about this, right? Because there is an extra fear around cancer and things like that. So that's immediately where people go. And I'll say, why do you think that? Right?
Yeah.
And then most of the time they're like, I don't know. I just Googled it.
Yeah, I was going to say,
it's other intuition.
Plays a huge role in that.
Oh, yeah. You type in headache, it's like you're immediately dead.
That's right.
So
I say, look for zebras and not for
that
horses.
Doesn't help the situation either, right? And so that can be a whole thing.
Yeah.
But one of my biggest stories is that in 2019, when I had a lump above my collarbone, I went to an ENT doctor, saw this doctor multiple times. She told me to go on antibiotics, that I was fine. And I was like, I want a biopsy. This is a lump. And I just don't feel, my intuition was like, something's off. Like, this is weird. And then I got this scan and they're like, oh, you're fine. Like, it looks good. And I was like, okay.
Was it a scan or a biopsy?
No, it was a scan.
Was it a PET scan?
CT scan.
Oh, huh.
Oh,
okay.
It was on the scan. You can look at it and see it. It was just missed by the doctor and the radiologist.
Huh.
You don't need to be a radiologist to see a fault tumor. Like,
I'm sorry.
It's funny now because it's just like, are you kidding me?
Yeah,
like,
they missed it. Wow.
Totally. So that happened. And then one day, I swear, I woke up and I just got out of bed and I was like, I got to get a second opinion. I couldn't explain it. I just had this intuition. I said, something's off. And then I advocated for myself, right? Yeah. This is what we're about to talk about. I advocated for myself. I found a doctor that was willing to listen. He biopsied it in that office that day. I was like, why was it that, like, it was a needle. Like, why didn't this other person do this?
Sorry, it's still not funny.
It's not, but it's just like, oh, I'm crazy.
It was that simple. Yeah.
Oh, you just stick a little needle in it. And then that Monday, he's like, I think you might have cancer. I was like, oh, that's great. But, like, this is just, yeah. And I'm like, okay. So the point is that I was almost gaslit and ignored for almost, so I first saw it like at the end of February of 2019 and then like didn't officially get diagnosed until June. Unfortunately, with Hodgkin's lymphoma in young women, it is missed for months. Like not like mine was a short time to be missed, but other women that I've talked to that have had it, they're like, oh, I went 9 to 12 months.
Oh my gosh.
Because I kept telling like I was gaslit. They were gaslit.
Yeah. Like, oh, it's nothing. It's just a cyst. Like, whatever.
Exactly. And they'll go in sometimes to the same doctor. Like one girl went into the same dermatologist like 8 times or 5 times. And like one of the major symptoms of Hodgkin's is like unexplained itchiness that you cannot stop. But it is like a foundational like symptom of Hodgkin's. Like you can just Google it. You don't have to be
constant itchiness.
Constant itchiness.
Wow.
Yeah. And it was just like, oh, you're fine. Like take this or take this. And it's like, after the 5th time, like, why aren't you referring that person out?
Yeah, after like the 2nd time, why are you not referring that person
exactly.
out?
My point. Exactly. It's like, but it was 5 times. And the point is that you just have to advocate for yourself. Yeah. And I just think that experience was just like, oh, hell no. Like, anytime somebody comes into the clinic and they feel like they've been gaslit, I'm like, oh, I got you. Like, what do you need me to validate?
Yeah.
And that saved my life, trusting my intuition and advocating for myself. And so, that was just like the craziest.
Yeah. That's crazy that happened to you.
Oh, yeah. I think it happened. And I was like, okay, this is weird. Anything that's a golf ball size, anything on your body, like you should be getting that biopsy.
Yeah, for sure.
I don't think you need to be a rocket scientist to.
Yes.
I guess in this case, a surgeon. I don't know, whatever. But
I don't know. Who is it that you saw? You saw the ENT, and then who did you see after
another
that?
ENT.
Another ENT, a different ENT. Yeah. So sometimes finding a different doctor. I think a lot of times what I see, right, with chronic pain is that too, like they just don't have any answers for it. And again, they didn't believe that adrenal fatigue and chronic fatigue syndrome and even fibromyalgia. Fibromyalgia is super severe adrenal fatigue, but I think the stat several years ago on that was like 95% of Western medicine doctors didn't even believe that was a thing, like severe stress leading to chronic fatigue, which is then why you get fibromyalgia, right? And fibromyalgia, that diagnosis for it, right, is like point pain at like 11 points in your body, which is a bullshit diagnosis. It's an interesting way to diagnose somebody. Oh, you have pain at 11 out of 13 spots here. That is, but then they don't understand what the cause is for it. Even that, there's a lot of stuff in the functional medicine realm, things that are coming out right now that just doctors really truly just do not have time to read or study or go do the research, which again is what we'll talk about a little bit later about like why that is, why this is happening. Yeah. My biggest thing right now is that I'm getting a lot of people who are coming in to see me as like a last ditch attempt to feel better.
Oh, it happens all the time with us.
And we'll start talking about, because in my intake paperwork, I have a systems check. So it goes through like all the systems of the body, right? Like this is like pain, neurological, like even ears, like ringing in the ears, that sort of stuff. And I definitely go through and we talk about everything that they marked off. Is it current? Is it whatever? And I get a lot of people who are saying like, I have all these symptoms and they just don't line up and whatever. That can be indicative of Epstein Barr virus, right? That there are a lot of different things that don't add up that then are an underlying viral load in your body. Yeah. And so I'll often go through that. Like, have they tested you for that? No, I don't even, this is what that is. Yeah. A lot of people who have something called MTHFR, I think I had told you this story earlier. I had a patient who recently came to see me, or a woman who just did a consult with me, who had 5 recurrent miscarriages, actually had a miscarriage and then had a child who, I think that child is now 5, and then had 5 recurrent miscarriages. So the issue is that she was able to get pregnant, just for some reason she was miscarrying. Yeah. And she spent something like $20,000 on all of these tests, was in with a fertility doctor. And I was like, this is why I think, have they tested you for MTHFR? No, didn't know what it was. Explained it to her. I was like, I would have them run that immediately. Like, there's only one fertility clinic actually here in Austin, I think, one that is like testing that pretty normally. Anyway, and I explained why I thought that was that. And she called me like a week later and said, yeah, so I went back into the fertility doctor, and the nurse practitioner came in And she said, I want you to test me for that. And our practitioner was like, no, we don't need to test that on you. And she was like, no, I'd really like you to test me.
Yeah, you have to advocate
for this. Like I want you to do it. And she said, well, just out of curiosity, why do y'all not test for that? And the nurse came back and said, insurance doesn't pay for it. So she was like, I don't really care. I will pay for it out of pocket. It was $75. And sure enough, what came back was that she had MTHFR. She had one copy of the 4 different copies of it. And it was for recurrent miscarriages. And so again, and then she was like, but now what do I do? Because I don't want to go back to the fertility clinic. They had told her, oh no, we tested you for ANA, which is a completely different test. That's for autoimmune stuff. It's like not the same, whatever. But she's like, now I don't know who to turn to because now I have this piece of information, but they clearly don't know what it is.
Yeah,
what do I do?
Yeah.
So again, had given her a couple of different names for that too. But even stuff like that, like going in and advocating and still having somebody tell you, no, we're not going to run that test, happened to a good friend of mine as well. I actually went to the follow-up appointment. I thought she had EBV. She was in an EBV flare. And the PA was like, no, I just don't think that's what's going on with you. And I was like, why are you not running the test? She's asking for you to run the test. What's it going to hurt if you don't, right? And PA was finally like, actually rolled her eyes at me because I was like,
ego.
Yeah, which is fine. And again, I don't go into those appointments. Like I did not go into
like
that appointment being
door.
like, hey, this is who I am. And whatever.
Yeah.
I had gone as a friend and she had wanted me to go because she was like, you're better at asking questions in that moment, right? In that moment, better than I am. And rolled her eyes at me. And then she was like, sure, I'll run the test, whatever. And then sure enough, a week later, huge EBV flare. Her numbers were like off the chart. And the PA didn't even apologize for like, hey, I'm really sorry. I should have listened to you. I should have run this test the very first time you asked me to run it on you. And just was like, here's the protocol, whatever. So it just is incredibly frustrating, even when you advocate for yourself, to have other practitioners go, no, we don't do that. And really that stems out of we don't know anything about that, which is a huge red flag.
Yeah, exactly. And it's like, Epstein Barr Virus is basically, you can have reoccurrent. A lot of people have been exposed to it, but a lot of people either have symptoms or don't. I have flares of it and I get chronic fatigue, but I first noticed it when I was, I think in 8th grade, huge flare up. Nobody knew what was going on.
Yeah.
Then finally, like I got sick again, a flare up again in freshman year, like completely debilitated for like 9 months. And I was even told just by a family member, get up, you're being lazy, go push yourself. And when it happened is I flared up more and I was just like almost debilitated, which then caused depression and all these things. Yeah. It was just crazy. But the point of all of it is just that the thing that's funny is like, people say so much about evidence-based medicine, right? Evidence-based medicine is 3 things. It is research, it is the patient, and it is your experience.
Yeah.
We are taking the patient out of evidence-based practice. So sometimes like people will come in and they'll say like, this is what's going on. Like, what do you think? And I'll go, okay, before I go in, like, what do you think it is?
Yeah.
Right?
Yeah.
Okay. Let me do an assessment and then we can talk about it and I'll see if it lines up because you are the only person that's living in your body 24/7. I'm seeing you for an hour a week. I don't know.
Right.
And my practitioners don't know about what I'm going through 24/7, right? And so if you have this hunch or you have this intuition, get it checked out. But also sometimes it's hard when you are, there tends to be, I know when I was younger, my whole family, that's just taught me to be like a hypochondriac. Like, oh my God, the second your eye twitches, like your eye's going to fall out, right?
You
like,
have a tumor.
And
that's
so
always the answer.
Yeah. And then you can go in this opposite extreme where you're just like obsessively checking everything. So it's just like how much of that is like anxiety and how much of it is your intuition, right? And so I think sometimes if you have anxiety, it's hard to figure that out.
Yeah. Weed out what's not the reality of it, but like really what's that and really what are you anxious about?
Yeah. What's anxiety and what's intuition? And I feel like that can be hard to differentiate too, because sometimes the anxiety happens because of the underlying condition.
Yeah.
And then it's just like this cycle, right? And I think that I'll get people, we were just talking earlier, we'll get people that have been to multiple practitioners and, years and years and years. And, I'm doing what I've been taught to do, what I've been educated to do, and my own research and things like that. I'm not doing rocket scientist things. Like, I don't know why I keep saying rocket scientists. It's not like I'm obsessed with them. I don't know.
No idea.
But the point is that I'm listening.
Yes.
Oh my God, I did not I listen. And and you do too. And it's like, it is a lost art. And it can be really frustrating for patients because
Yeah.
it's like, oh, it happens a ton with pelvic floor stuff.
Oh, I'm sure. Oh, yes, actually, it does. Yeah.
All the time because so we'll go into why this happens. So I believe that with certain things, like with the pelvic floor, it happens because there is not pelvic floor education widespread anywhere. Like the educating I had to go to Con Ed.
Yeah.
In PT school, I got like an hour of it maybe.
But what was that about? That was just about like there are 37 pelvic floor muscles and 3 layers, and like
she showed
probably
me
more like the anatomy.
What I remember about her, she was so cool because I remember being like, oh my god, I want to be her when I grow up. Because like you're so moldable when you're like in school and you like have people. She comes in and she's just like this bubbly person, and she's like, oh my god, I love pelvic floor physical therapy. This is this. And I remember that energy that she had, and I was like, I feel like I'm gonna resonate with that later, but I'm not there yet. Like I don't think I'm called to do that right now. Yeah. But also like in med school stuff too. And even in different, you didn't learn about it in chiropractic school, did you?
No, other than just like general, I think, anatomy and physiology. I think we know more now. I had my son, he's now 12 and a half, but I wasn't rehabbed properly postpartum after his, and I'm still having deficits from that, admittedly more minor. But what I tell women, that's always a question that I ask them, were you rehabbed properly postpartum? Yeah. And they'll a lot of times be like, no, or like, oh, I had a section birth. And I'm like, that's a common misconception that women who had C-sections don't need pelvic floor, which is a huge thing. But I said, we know more now than we did even 5 or 6 years ago. We admittedly know way more than what we did. So that's also the evidence-based medicine is that things are constantly changing. Right. You and I were talking earlier, blood work itself, just blood work is like 25 years behind where it should be. So it really and it doesn't include hormone testing is more urine-based, right? Cortisol is more saliva-based. Like there are better ways to test for stuff and they just don't know, right? But yeah, admittedly, even in medical school, right? In med school, doctors actually in their second year go into pharmaceutical classes, right? And so chiropractors actually have more body physiology than a medical doctor do. We have more hours in how the body works as a whole than med doctors do, which is not saying anything except that they just don't really know except what they're taught, right? And you were talking about like coming into pelvic floor, you had to go through additional training to get that outside of school. Well,
musculoskeletal experts, right? Like obviously orthopedics is going to be different, right? Like orthopedics will get all the muscle, the full body and all that stuff.
Yeah, but that's usually a specialty.
But usually what happens, it's a specialty because usually you go to and then you can branch out. But even with that, usually what happens is like, then they get focused on like certain joints. Like this is the shoulder doctor, this is the knee doctor, this is that. Wrist, and then you can get it separated when it's all, I feel like chiropractors and PTs, like we see it all, but I do think that in certain environments, we're taught to just focus on just here. Again, I have plenty of surgeon friends, plenty of medical physicians, all these things. We're not bashing them. It's just more of understanding why this is happening. And I do think that I've seen different schools, like medical schools, start being more collaborative with other. I think Duke was doing it, and I think UT Dell is working with a similar program where they're all inclusive. Like they'll talk with physical therapists, occupational therapists, social workers, chiros, and it will be more inclusive. But what I found is like the old school way before was just like, oh, I know all, and what I say goes. And that's not okay because you don't know everything. Like, I don't know what physicians know. Like, that's not what I do. Like, they, and then vice versa, right? That's why we have this collaboration. And that's why we have us all working together. Like, because typically chiros and PTs, like,
hate each other, and I don't
hate each other. And I'm just like,
but it's not my experience. Like, I'm the very first one.
In ortho, it's a thing. It's like, oh, don't go to your chiropractor or don't do this. And it's like, there's good and bad PTs. There's good and bad chiropractors. It's just reality, right? And it's like, it is what it is.
I think the other thing as well, like you were talking about, and again, we're talking more about women. This happens, I think, to men as well, too. But with women, again, we also know more about the somatic experience, right? Which is also where we're talking about intuition and listening to your body and the way that you feel your experience in your body. We know that certain areas hold certain emotions, right? There's the body keeps the score, right? There's all of this somatic work. There's Peter Levine, like all of these.
Can you explain what somatic is for them?
So somatic is more of a felt sense in your body. I guess I would explain it that way. Somatic experiencing, if you want to look it up, it's Peter Levine's life work, which he figured out in most mammals, right? Like if a zebra runs away from a lion and escapes, right? He doesn't get eaten. Most mammals will shake to get rid of the excess adrenaline. Humans don't do that. We actually compress it into our nervous system, right? Like our nervous system will lock down at the moment of trauma. And again, unless you're doing something actively to release those traumas, and they can be like what we call micro traumas, right? Which is something that a point in your life where you got a really bad piece of news and it was just startling, or even sometimes like jumping out at somebody, right? That sort of whatever. That's considered micro trauma. Then you talk about big traumas, right? Surgeries, car accidents, sexual assault, like all of those things, right? Our body really does start locking down. So again, a lot of women in their like late 30s start to have sometimes physical symptoms of emotions being held in their body, right? We know that the pelvic floor holds grief and stress, specifically in psoas, the big hip flexor muscle, right? Yeah. We know that liver holds anger. We know that lungs hold grief, right? We know all of these areas of the body, right? So we also have to, as a practitioner, I also then have to look at that as well too. Yeah. What is going on emotionally? If I'm seeing the same pattern, the same misalignment pattern in the spine, I sometimes go there as well too. Or if people are coming in during the consult and we're talking about whatever, sometimes that is a question that comes up, which is, what are you dealing with emotionally? Like, have you had chronic stress in the last 3 years? I had a lady, actually such a sweet older lady, like probably in her mid 60s, come in the other day. Yeah. Her back had just got thrown out and she was like, I need you to fix me. And so we adjusted her. And then she came in like 2 or 3 days later and she was like, I'm really not that much better. Yeah. And when I put my hands on her, because this is the way I practice intuitively, a lot of times I'll just get stuff as I have my hands, which is very woo, but it works for me.
Hey, I like the combo. That's why we're talking about this. Like, right? I had surgeons on, I have medical doctors, I have other PTs. Like, we got to have all of, I want everyone to have access to all of this information. Yeah. And because if it's blended together, it is so fucking beautiful.
It's great. Yeah. So as I put my hands on her, the second time she came in, when she really wasn't that much better after the adjustment, I was like, okay, so I have to ask you this question because it totally came up. But emotionally, what have you been under a lot of stress recently? And sure enough, as I'm adjusting her, she was like, well, yeah, it would have been the 50th, or my 50th wedding anniversary is coming up. Oh. And like that has been overplaying. And then something else about, she had like 3 friends that had died really suddenly. So she was still grappling with her own mortality, right? And anyway, just talking about that, I could feel the difference in her body. And then also too, then she came to see me the next week over the weekend. And I said, you should probably just sit with that. If you're a journaler, like if you journal, if you write, if you have a good friend to talk about it, you need to, I think some of what is going on, because of where she was having the pain, was mainly pelvic floor, low back, like here in the front. That is probably because you're dealing with all of these emotional things. And she came back in and he was like, I think really just like telling you really helped. But that is also a piece that I feel like Western medicine is not very good at addressing. And again, this is not bashing them. Again, you just don't know. It's just one of those things. And not all chiropractors, but just like this, treat like this. A lot of people don't know this information. But for me, in my own journey, my own health journey, my own journey post-divorce, post-gaslighting, all of that, it has become more important to me when I'm seeing something recurrently. I have dealt with so many blocked ears this year. Like women,
that's what I need you to come work with.
Women coming in going, I can't hear, or like this is not like something draining. Yeah. And usually if it doesn't clear after like the adjustment, I'll be like, okay, so there's something that you don't want to hear.
They're like, what does that mean?
What? The very first time that happened to me, I mean, one of my friends who does all the holistic stuff was like, I've been putting garlic oil and whatever. And I said, okay, this is coming up for me, but like, what are you not? There's something you're not wanting to hear. And I was like, I know it sounds weird, whatever. I just went out. And then later she came back to me and said, okay, so I thought you were crazy when you asked me that. I literally got out to my car. And so she sat there, she was in the middle of like selling a business that she had grown up and like selling that off. And she said, I asked myself, like, what is it that I'm not wanting to hear? She said, I then proceeded to cry in my car for like an hour. But anyway, that is also a really big component, and it can lead to the gaslighting, right? Yeah. Because they're like, that's why they think it's in your head. Because a lot of times we're holding something that we can't put words to, but it's emotion, grief, stress, anger, all of those things. And I'm seeing it more and more. I saw even more post-COVID, right? And what I tell people is like the last 3 years have been dumpster fires for everybody, especially women, because we are the emotional barometers of the world. We're also the emotional barometers of our family about just what's going on. And we dealt with the brunt of all of that crap shutting down, right? The world shutting down. So anyway, that's also, I think, a big piece of that as women in the healthcare system, where they don't really talk about emotionally what is going on in the body.
Totally. Yeah. And it's like, and like we were saying, like I started as a PT, is like mainly ortho based. We did not talk about any of this. Okay. Once I started training pelvic floor, I was like, oh my God, I'm more woo than I thought. And I'm all about it. I'm loving it. And so what's interesting is that people will come in, like I'll give you a specific example. Like I had a lady come in who was just chronic pain, full body, everything. From an ortho perspective, it was just like, oh, we call it like central sensitization, right? It's like, okay, something's going on with the nervous system, but that's where we stopped. Like that was just like sensitization. Okay, like get them exercising, get them moving, right? And I was like, okay, we can get them moving and exercise can help with that. But like this person in particular, I was like, what? You've been to a lot of doctors. You've been to a lot of PTs. You've been to a lot of chiropractors. Is going on in your life?
Yeah.
And I go, and am I the first person to ask
you that?
And
yes.
She goes, yes. And I go, what's going on? She goes, I work 12 to 15-hour days. I go, why? She goes, because I take on other people's projects at work. Why? Because I can't say no.
Oh.
And then if you ever, I always mess up his name, but Gabor
Mate. Yeah.
Mate. Okay. His work talks about all of this stuff. And I know that some people don't like it, or I'm all about it. I think it's great because I think it explains the body as a human, because humans are emotional creatures. Like that's what makes us different, is like we have emotions, we can react, and like we're not always objective. We're never just objective. Like it's just reality. We see it through the lens of emotion.
Yeah.
Right.
And our own experience in our own bodies. Right.
So if I'm looking at somebody with like chronic pain and I'm not saying, hey, what's going on in your life? So the first thing I said, I go, hey, we're going to do some PT stuff. Don't get me wrong. Like we will get in and like I'll work on their muscles and we'll do some exercise. But I want you to just notice how your body feels when you don't say no.
Yeah.
Just notice. You don't have to change anything. I'm just going to plant this little seed in your head. And whenever you're ready for it, you'll notice it. Yeah. Because it's a long process, right? Because to be a person that doesn't say no, to be a people pleaser, which is me, recovering. And so,
me too.
Yeah, I'm a recovering people pleaser. That shit, like, can destroy you, because you just are constantly trying to please other people and putting your health on the back burner.
It's a boundaries thing.
And it's funny. And it's not funny, but it's like, how many women do you see that have autoimmune conditions, thyroid conditions compared to men? We're talking just like binary, right? Oh. It is. And people will say, oh, it's hormones. And I'm like, okay, I feel like, yes, it can be hormones. Yes, it can be, but that's not the end all be all. Yeah. How many women are like dealing with shame and guilt and working moms? I mean, oh my God.
I always say mom guilt is a bitch. Like,
oh my God.
Can't get rid of
mom guilt. And then even adding on the layer of being a working mom in a male dominated industry, you tell me that their fight or flight response isn't going to be on all the time. Yeah. But that's not talked about because, okay, if you don't understand that, you're not going to validate it. But the reality is like women are taking on a lot of emotional shit and it's manifesting in their bodies. Yeah. And I'm not saying a one size fits all. I'm just saying like if you're dealing with chronic symptoms or something, like I dealt with chronic congestion for years. My cancer was on the right side of my neck. I had a neck injury years ago that almost led to surgery. I couldn't move my arm, which was weird. It wasn't even an injury. It just happened one day. And that was scary in and of itself because that's something that like, if that doesn't get better, you have to have surgery, right? Like there's just no way around that. I have to use my arm. But looking back, and I kept getting like neck flare-ups and I do PT and all the things that like biomechanically I thought I would do. And then I started looking more into like chakras, which is what you were saying. And it's like different parts. Yeah. And the throat is your inability to speak your truth. Yeah. And I just realized like I grew up in a cult, basically. Like a cult.
Sorry, not funny, but yes.
It is. I mean, it's, I
You
have to laugh.
enough. You and I have talked enough about that.
I have to laugh about it because like my sense of humor comes from deep hurt. The only way that obviously I've worked through it and I'm working through it and things like that. But like I, as a woman, was like, if I ever spoke anything about what the common belief was or questioned it, I was shut down real quick. Right. I was I was just like pushed out.
Yeah.
And now I'm pushed out because from family and a community that I grew up in, because I questioned. I had questions. I had my own things that I wanted to know.
Yeah.
And I suppressed all of that because I wanted to keep the peace.
Yeah.
Right. And now that I'm like, oh, fuck it. I'm going to do a podcast on medical gaslighting. I'm going to talk about this.
Yes.
I'm going to do this.
We're going to ask questions.
I'm going to be my true self. Like, I mean, to be honest, I haven't had a neck flare up in like a long time. But if you look at it from like a biomechanical perspective, it doesn't make sense. Like even the MRI like didn't even show a bulging disc.
Yeah.
But I could not move my entire arm.
Yeah.
Like,
this is really random. This is a tangent. Have you ever heard of Heller work?
no.
So Joseph Heller he was an original student of the Roffing guy. I can't ever remember his name, but the Roffer.
Okay.
And he realized as he was doing the Roffer series that different body parts also hold emotion. And so as he was working on, it's like an 11 series session. And as he was working on these, it's like legs and feet, right? Like that's firmly planted on the ground, right? Lungs are breathing, and what are you holding? Grief there too.
Yeah.
Shoulder, neck, right? It's all about like, what are you holding? What are you holding for other people? Anyway, so that goes back into that sort of emotional connection as well, the emotional body connection as well. But anyway, it's just interesting that you also started having issue that you had issues like not being able to speak your truth, and then that was physically manifesting.
And I had no idea. I had no idea, honestly, until I've talked about this before. I had to go through extensive therapy because it was like a really bad marriage, a lot of not being taken care of during cancer treatment, and then losing an entire family. And then on top of that, from the divorce, and then on top of that, just being like, okay, why did I choose this person? Why do I keep choosing these people around me that aren't supporting me or aren't serving me? And then you have to dive deep. And then you unleash all this stuff. And I was like, why did I do this? Why did I do this?
You can't. You have to go through
You
it.
have to go through it. And this is why people don't do it. And then I was like, oh my God, this stuff starts making sense because I never really understood. But it's like, we're all made up of energy. And it's like, if we don't look at it from that perspective, it's just, like we're going to hold things at different parts of our body based on what we're feeling deeper inside. And sometimes MRIs won't show anything. Sometimes injections can help. Don't get me wrong. Western medicine still help. Like, it's just like the other day, I had a sinus infection. I kept trying to do all of like the natural things. And finally I was like, fucking give me the antibiotics. Like, and it was like the next
I can't breathe.
It was like, I can't breathe. Like, whatever, just give me diarrhea for a week from the antibiotics, like whatever. But the point is that, well, antibiotics upset my stomach, might be TMI or whatever.
No, I'm just laughing because that's usually what happens.
But it's like, so I needed it. Right. And so like, you just do what you need to do. But it's also like, it's more of, I'll be fully transparent. Like I'm on an antidepressant but I have tried everything around it to help my depression. And I think just with the significant trauma from childhood, I just think that maybe one day I can get off of it. But the point is that it has helped me with all these other things. But if it's the first thing that somebody is sent to, that's BS.
Right.
Because you're not even having a conversation with them about
what's going on in your life. Yeah. And that was the thing, is that there's no shame about doing any of the things that are offered to you. My bigger issue is that if that is the first thing offered, or it's because, again, they don't know, or your blood work is perfect and we don't know, so why don't you just try this? That is where I have the issue with it.
100%.
Is that it's not jumping in. There's none of this is shaming the people who are on that. It just sucks, especially as women, when they are not addressing everything.
To that.
Interesting. You were talking about the energy thing. So I have what's called an energy mastery certification, which is all about cleaning out those chakras and energetically keeping your body clean, putting down boundaries.
Explain what chakras are.
Oh,
I don't know how to explain them. I'm like, there's some like, I'm still newer to the Eastern medicine. I'm like, I don't know, there's some like energy in this area. And I think it's something to do with truth.
So there are different energy centers in the body, right? And so there's like solar plexus, which is your power center, sacral chakra, basic, which is tailbone. Sacral and basic are money, power, and obviously sex, right? Which are all intrinsically linked, which is also really interesting, which again goes back into the pelvic floor thing. A lot of us who grew up in the church in interesting households where, like, again, sex was not really talked about or whatever. We hold so much shame in that, which is a whole different podcast about like releasing shame in your pelvis and enjoying sex again like that.
I did one on purity culture with a therapist a few months ago because I was like, I dealt with this.
Yeah. But yeah, so anyway, so again, the different energy centers, and again, like throat is about speaking your truth. Again, solar plexus, there's a back solar plexus. There are all these different just energy centers. Again, some of them sometimes become blocked. That's a whole nother thing. But the energy mastery certification, actually, when you take it, it talks about it takes 8 years. 8 years for something out in your outer energy field. Because again, we know that the heart can project an energy field, I think up to 6 feet around you. That's how powerful when you are truly feeling loved and whatever, when your heart is actually functioning the way that it should be, it is a measurable energy field.
Yeah.
But it takes 8 years for something to come from the outside energy fields into a physical manifestation into your body. So you were just talking about childhood trauma, right? Generational trauma. There's so many podcasts and different speakers about that as well too.
Yeah.
But sometimes it's not even really what you're currently going through. It could be something that had happened to you as a 5-year-old, as an 8-year-old, happened in junior high, and it's coming up, right? That goes back into the nervous system being locked down to where then all of a sudden your nervous system is so overwhelmed that the triggers for that are so hair thin that then all of a sudden you're feeling overwhelmed and anxious, but it's just the accumulation of all of that.
Yeah.
So,
and then your body can't fight it because as well, right? Because your nervous system is so heightened, and we know that decreases your immune system, right? So that goes back to the scientific point, is that like, because this is what's helped me understand it a bit, is just like, okay, how can I blend these two worlds together in my brain? Because I need to understand it, right?
Yeah.
And it's exactly that. It's like, okay, well, it's just and you cannot deny that we are all dealing with some emotional deep stuff, and it's going to manifest in different ways. And like sometimes, like for instance, like I remember like before my wedding having like extreme back pain.
Oh, interesting.
And in retrospect, obviously,
maybe your body's first red flag.
When I look up, it was all red flag. But like the point is that I remember, and then looking back, it's like feeling unsupported.
Yeah.
Like that's what it means, is that. And I was like, oh my God. So now when you feel this thing, I'm like, ooh, what's going on emotionally? And then what can I do physically to help
it?
Right? Because it's like, if you just go in and somebody's like, oh, it's just emotion, like just work on this. And I'm like, work on me. Like my back hurts still.
Yeah.
Like,
and again, chiropractors, we always talk about there are 3 reasons for misalignment, or what we call subluxation. And those are thoughts and traumas and toxins, right?
Yeah.
It's your body's toxin load. But again, for most women, what I see, I've been doing this so long, is that there is a physical manifestation. Almost all of those women are subluxated in some way, right? And so the adjustment does help. It does help calm the nervous system down. It does help immune. But it's when, again, there's a recurrent pattern there that then we go into.
Oh, totally. Yeah, exactly. It's like if somebody comes in and they sprain their ankle, I'm not going to be like, what emotional trauma?
What do you not feel supported about?
Dude, that dude just like sprained his ankle, like whatever. But if it's like, if you've come in to see like a million practitioners, I'm like, okay, what worked, what didn't?
Yeah.
Like, and it's just insane. Like the amount of people aren't asking about lifestyle, but again, like I was that PT that didn't ask about that. And it's because like I didn't know. And so the more that we're talking about this, the more we can really help people.
Yeah. And again, my favorite quote is by Maya Angelou, right? And she says, you do the best you can until better, right?
Yeah.
And when better, you do better. And that I think is every practitioner's goal, truly.
They're well intended.
They're very intended, but it is also about there does need to be time researching, leaning into, or saying, I don't know, but I know somebody who might be able to help you, right?
Totally, yeah.
So in the context of that sort of gaslighting or not taking people seriously, there is a lot, especially for women, about emotions, about lifestyle, about what stress burden are you under, right? Because I do think that was not the lie about feminism, right? Is that we can do it all. And the reality is that most of us are crumbling underneath that load.
Yeah.
We do need to address lifestyle, right? And emotionally what they're, and I had said, I think that was probably the biggest lie that feminism had sold us, was that we get to, like, we could do everything a man does and everything that, like, whatever, but at what cost, right? For most women, we are crumbling underneath that load. Like, it's not that I don't, again, buy into some of that, but I see too many women who are, again, crumbling underneath the emotional load of having to do everything, working and then childcare. And then, which again was what I was talking about. Like we saw that a lot post-COVID, was that we took on the brunt of all of that stuff going on, right? And so again, the lifestyle thing is a big piece. I think it's a very missed piece. I think emotionally, what is going on?
Yeah.
And just asking somebody like, what is going on with you?
I think
That's
like,
valuable.
like from a feministic, is that that's what I word? Feminist? Like a perspective, I always think the name of it gets a bad rep, but the reality is it's like you're saying, it's okay to lean into our feminine energy and ask for help.
Yeah.
And I think that's what you're saying is like, yes, we can do all the same things men can do, but we should also ask for help. Yeah.
And
And should we be running ourselves to the ground and not asking for help? Right. And so obviously I'm like pro what anybody wants to do, but I want them to have all the information and be like, hey, it's okay to ask for help.
Yeah.
Because a lot of people don't ask.
Yes. And I'm the one worst.
Guilty of it. Like I'm guilty of it. Like I'm like, oh my God, I'll call a friend when I'm like sad. I'm like, oh my God, today am I burdened? And then I have to talk to myself, be like, no, that was programmed into me. Like I'm okay.
I'm okay. I can ask for help.
Yeah. And so I mean it's also leaning into different energy, right? Because if you're constantly trying to prove something all the time, that's going to weigh at you too, versus just being like, what if you just accepted that you're exactly where you're supposed to be right now?
Yeah.
It like softens a lot. It's like, oh, I don't have to run around with my cut off all the time. Cause I remember I was the person like before I would make everything back to back to back to back, everything. Like if I was 15 minutes before like an appointment, I'd be like, what a waste of time. Like, oh my God, I can't believe it. I wouldn't eat lunch for years when I worked at a clinic treating like tons of people. I just was like, it's inefficient. Like, why do I need to sit down?
Why do I need to feel my body? Nobody needs that.
And I was like, why am I constipated and bloated all the time? If I'm like not sitting down and eating, I'm shoving food down my
not digesting
and not digesting. So I'm bloated and then I have GI stuff. And some of it's even just like breaking it down to the basics.
Right.
How are you sleeping?
Yeah.
What are you eating? What water are you drinking? Like, are you drinking filtered water? Are you drinking tap water? Like, do you enjoy like the bed that you're in? Are you sleeping? Like your partnership, all these different things. And it's like, how do we look at somebody from a whole perspective?
Yeah.
And so again, bringing it back to like, I don't truly believe most practitioners are ill-intended. I think it is more of a time issue. And so that's why I go, why does this happen? Yeah. It's a time issue. Literally, for the people that don't understand, insurance is ruining our healthcare system. And I don't know exactly what the best answer is, but it's not what we're doing now.
No.
And so basically what happens is I'm out of network with insurance. And so are you. And so basically what I explain is that like if I took insurance, right, I maybe get reimbursed maybe $60 to $100. And $100 sounds like a lot, but I have to fight for that $100. Yeah. Like that's not handed to me. Yeah. And I have to pay 10% on top of that for billing plus the 3% credit card fee. Yeah. And in order to even get like maybe then $50, then I have to like wait for that. And to actually make money, I need to treat somebody every 15 minutes, clump them all together, right? So then what happens is and that happens, like people will be like, oh, my doctor was 1 hour late. And I'm like, I have plenty of doctor friends and I know they don't want to be late. Yeah. And I know they want to spend more time with you. And I know they didn't go to vet school to see you for 5 minutes. Yeah.
But and again, that's the thing is that I always explain to patients is that then I'm at the mercy of insurance, right? Which means that I have to take X, Y, Z patients. I have to see them X many. They want to dictate care is usually what I say. And again, we know a lot of really good doctors. I know a lot of really good doctors who
I'm just saying healthcare practitioners,
in general. And again, healthcare is not about health; it's sick care, right? And insurance is an unregulated industry. There is no regulation on any of it, right?
The insurance brokers, they make so much money on just like selling insurance to companies. Yes. And it's like, oh my God, if we just like buy, we could have a whole other thing, but it's like, there's some sketchy stuff that goes on behind the scenes. And half the time that money isn't even going to the health person. Right. Like people are like, oh, if that person, there's these so many patients, they must be driving this car to this car. And I'm like, oh, you don't understand that.
I understand how insurance works. Which is again, that is the bigger umbrella issue, right? Which is all of these care providers literally have 15 minutes with you. They have to come in, they have to listen. A lot of times they don't have the time to spend with that patient, right? Going, what is your lifestyle? What is going on emotionally? Not only do they sometimes not know to ask those questions, but it is literally like they're trying to do their best to get you the help that they think that you need or that you need in as small of a time as possible, right? So then you kick out. So again, it's just a broken system in a way as well.
Yeah. And I think what sucks is that the healthcare practitioners are the ones that get all the shit for it.
Yeah.
You know, it's
it's not about insurance. It's about the
because you don't see their
themselves.
faces. You don't see their faces. Like you don't see them getting their checks and all that stuff. You see the healthcare practitioner. And then also, and the thing is that's crazy is that, like you're saying, it's a reactive system. It's not a proactive system. If we were more proactive, we'd be having more of these conversations.
Yeah.
Like there's a lot of doctors, like direct primary care. So like I work with a direct primary care and I pay like a certain amount of money a month. I think it's like $80 and I can ask her questions and she's really helped me more than she's just been amazing.
Yeah.
I never had access to a doctor in that way before.
Yeah.
What they're finding is that people's health, they're getting better and they're staying healthier because they have this ongoing continuity of care. Right? Versus if I didn't have that, I'd have to wait and weeks to get in or whatever. I'd be like, oh no, it's too, my copay is like $150. I'll just wait until I'm like dead.
I like with the sinus.
But the point is that it's just the way that it's set up. But to be fully transparent though, like the only reason I know this stuff is because I went through hell and back with my health. And I always like to say, like, why is this happening for me? Now I know why it all happened for me because I can spread this message.
Yeah. It changes the way that you practice.
Totally.
Yeah.
And I'm sure, I know there's going to be orthopedic PTs listening to this and be like, Mary has lost your freaking mind. And I'm like, fine. But like, what? Like when you have a major health issue that nobody can explain, sit down and I will listen to you.
Yes. Right.
And we will have a conversation where we can tell somebody to do a bunch of exercises, but then if they're not doing them, well, how about maybe I actually need to press?
Yeah.
So why aren't we being like, hey, here's a therapist or guiding them to resources and understanding like, hey, it's not in your head. Like depression literally affects your entire body. And there's neurotransmitters in your brain and all these different things. And then just understanding how our past traumas, and I know that trauma gets thrown around so much, but it's like an inner child stuff, but it's true. It's like our bodies hold on to that stuff and it will keep reminding you until you listen. It will keep being like, hey, hey, and then boom, then you're shoved off of the traditional medical cycle. And then that's where we come in. It's like, hey, it's not cheap, but it's also not cheap. It's expensive to have insurance. And then you have to pay the deductible. It's like, you're not understanding that the reality is it's like, sometimes it's actually more expensive to go in that work. And you don't get the quality.
Yes. And you still have to pay the copay.
Oh, yeah. The previous place I used to work, sometimes people are charged like $400 a visit, depending on their insurance.
Oh, my gosh.
And because it's a hospital basically. And I'm like, how is that a thing? I left after all that stuff happened, but not all the patients have that, but some do. And it's like, oh my God, that's a lot of money. Like $400 a visit. Okay. Until you hit your deductible, which the whole deductible thing is really crap because, okay, if I pay for this, it goes towards my deductible. Okay. But just a reminder, your deductible resets in 2 months. So like,
it doesn't matter.
It doesn't matter. But anyways, so then what can you do about it? Right.
Yeah.
And
like
so
the gaslighting
and things like that is,
or to ensure that doesn't happen. I don't know if there's a way to truly ensure that it doesn't happen. I think our biggest thing is like to be able to advocate and to do research. It's been going on. This is what triggers it, blah, blah. And sometimes men will come in and they'll be like, oh, I don't know. It's been happening for like, I don't know, maybe a year, like whatever. I mean, it's just a very different whatever. But in order to like, again, find those and to be an advocate for yourself. But the red flag there is that if you're asking for something, if you're asking them to run a test, asking them to, run blood work or asking them whatever, and they immediately dismiss it out of hand or they don't agree to run the test, you are the customer, honestly. And so that is the biggest red flag to me, is that if you are asking them to run something and they dismiss it out of hand and they won't run it, then it's time to find a new practitioner.
It is. I do feel like that from a practitioner standpoint, it could be like, it's a fine line with that too, right? Because if somebody comes in to me and they're like, I want this, 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 and this. And I'm like, why'd you come to me? You know what I mean? It's like, well, So you could almost go to the two extreme,
Two
right? So I just want to point that out. But
Yeah.
the point is that, like, if you're having like a reasonable request and you're
Yeah.
like, listen, this has been going on, and this is why, like, what do you think about this test? Like,
Yeah.
I'm interested. Da, da, da.
Yeah.
And
It's a dialogue.
yeah, if you go up and you're like, give me this test now, it's like, okay, get out of here.
Yeah.
But the point is that, yeah, you're having a dialogue, you're having a conversation, you're included in the conversation, and you're acknowledged and you're validated. If you feel like you are not validated and you are just dismissed, that is time to seek alternative practitioners. The issue with that is it's more time and more money.
Yeah.
Right. And so that can be like, I had somebody the other day that was a friend, and she was like, well, I was supposed to see this doctor, but they never called me back. And I go, you have to call them back. Like, if you can't, like, if you get a blood test, right, and like nobody calls you back, don't assume it's normal.
Yeah.
Like, you could have fallen through the cracks, right?
Yeah.
And so, yeah, it's being like, okay, advocating for yourself. Because if I didn't advocate myself, I don't know if I'd be here.
Yeah.
And that's deep.
And that's scary.
It's scary.
It's scary.
Yeah. And I wouldn't be here with a raspy voice sounding like mine. Oh, this voice sounds so sexy.
Yeah.
By the way, this is so silly, but when you said mammals earlier, the
Yeah.
immediate song came in my head. Do you remember that song? You and me, baby.
Oh.
Mammals. I don't know why I'm so
Yes, and now probably every time I say that to somebody,
5 years
I'm
old.
gonna- yes, I'm now going to think about that song. So thank you, Mary, for putting that in my head.
But
Hilarious.
it's, finding somebody that will listen, a dialogue, feeling included in your healthcare plan, and
Ultimately, just believing that what it is that you're feeling is legit.
well, whatever you're feeling is legit. And that's the thing, is that it is real,
Yes.
right? And so why is it real? Like, what is going on that is making it real,
really-
right? And so how can we work with that, right? Because if somebody comes in and they're like, I think I have a brain tumor, I'm like, okay, well, what are your symptoms? Well, I just started, I had a headache for yesterday and like the day before and for like a week. I go, okay, well, what has changed? Oh, well, I got new glasses. And I'm like, oh, okay. Well, like, before we go to brain tumor, like, let's look at the glasses, right?
Right.
And
That's a huge
dehydration.
one.
Oh,
Yeah.
a lot of different things, right? But if
Yeah.
you are coming back over and over and over, it seems that, like, you've got to get that checked out, right?
Yeah.
If you come in and you're like, I think I have a brain tumor, I've been spontaneously vomiting, like, I've lost a bunch of weight, I can't sleep
in the
at
middle
night.
of the night. Yeah.
Oh, I'm like, oh, you need to.
Well, get that checked out.
I had somebody call the clinic once and they were like, hey, I've had a chronic cough and I'm peeing myself a lot. Like, should I come in and see? And I go, wait, why do you have a chronic cough?
Yeah.
I've had it for a year. Well, okay. Like, I am
Let's
happy.
address that piece first.
I was like, I am happy. Like, they already had mentioned financial stuff. And I go, okay, listen, I want you to get that cough checked out. Like, if you need to allocate your funds, go to a pulmonologist, go to somebody and get it checked out. And she was just like, oh my God, it had not even occurred to her to do that.
That
And
a chronic cough.
chronic cough. Oh, please get it checked out, right? Like, save your time and go to them and then come back to me. Like, obviously I can help you with that stuff, but ethically I'm like, oh no, like, let's go do that route first. I'll be the first to say it. I mean, I run a business, yes, like, but I will always be ethical. But the point is that if you're not feeling heard, find somebody that will help you feel that way. If you're not sure even where to go, it's tough, right? It's like, if you trust a practitioner in general, if it's a friend or family or somebody you worked with before, good people know good people, right? And again, not saying that they're bad people. It's just more of like-minded people, right? Like Allie and I, like your Dr. Allie and I, we share a lot of similar clients. And then if, I just sent you somebody recently, it's just like, hey, like, what's your opinion on this? And it's like, it's a collaborative approach. It can be a beautiful thing when it's used right. But unfortunately, we're all dealing with our own stuff. And then you're working in a healthcare system where not a majority of suicide of doctors is at an all-time high. It's at an all-time high. So it's like, even if they're not showing up for you, it's like, what's going on? Like, their mental health, like that. Gosh, like, there's just a lot to unpack with all that. And so it may not mean that they're a bad provider. It could be mean that they're going through some shit or they're burnt out, or maybe they just don't know or whatever. And so the point is that finding somebody that will meet you where you're at, and that is the most important.
Yeah, exactly.
Yes. And so how can people find you if they would like to schedule with you or just follow you?
Yeah.
Like the IG?
So Instagram is at Lotus_ATX. My website is lotusatx.com. I'm off of Mesa Drive here in Austin. So yeah. Pretty.
Everybody loves Dr. Allie in Austin.
Thank you. That's so sweet.
They're like, oh my
And
gosh,
so
Dr. Allie. That's how we met.
Yes. It was actually a patient. He was like, you and Mary should meet. Y'all have a lot of, like, yeah, you should really meet
It was
each
like
other.
the second we met, I was like, oh gosh.
It would have been like a 3-hour lunch had you not been like, I have somewhere I have to be. Yeah, but it's great. And again, like-minded people typically follow like-minded people. It's great.
Yeah. And some people are looking for different personalities. Like I might not be the best PT for everybody, right? If a PT doesn't like somebody that's silly and authentic.
Yeah.
I'm weird. Like,
yeah.
I'm pretty sure.
Well, that's what I was saying. Like I live in the woo. So like, yeah, it's great.
I love it all. So
awesome. Thank you, Mary.
Yes, we will provide her information in the show notes and we will see you in 2 weeks.